Here with us now is Dr. Christopher Doring. Always great to see him and get his insight. How are you? Thanks for being
I'm
here.
well. Yeah, thank you. It's good to be with you, Mary.
So we have some exciting news today. Pfizer released its results of its clinical trial in the vaccine in kids 12 to 15. So first, what are your thoughts? And
Yeah, great.
what are the results?
Yeah, great news, and does appear to be just as effective in that age group, younger children, as it does in adults. And so, as here on this day where we are advancing to anyone who's currently eligible in Indiana, it's awesome to see this new data coming out that looks like we'll be able to lower the age down to 12 as soon as they can get the approval from the FDA.
Okay, so I'm wondering, this seemed to have come out pretty quickly. I don't know, I haven't been following it as closely as probably others in the field, but how confident can we be in these, I mean, they're saying 100% almost, in these results?
Yeah, I mean, the numbers that they have enrolled are smaller, certainly, than they were in the adult populations, but they have been going on for several months now, and so they do have enough data to determine sort of that statistically significant impact. It looked as though they had 18 cases of COVID in the control group and 0 cases in the vaccine group, and so that has led them to conclude that the vaccine seems to be approaching 100% effective at preventing the spread or the acquiring of COVID in those who've been vaccinated.
Mm-hmm. And you had mentioned the number of participants in the trial. What do we need? What moving forward? How many more participants would we need to in the next phase to give us just a little bit more confidence?
Yeah, I mean, I think we can be very confident. I think the number is somewhere between 2,000 and 3,000 that were in this particular arm of the trial. Keep in mind that there were tens of thousands of adults in the prior arms, but they designed these trials to have sufficient power to be able to draw these conclusions. And so the fact that they are seeing 0 cases of COVID in a relatively significant number of individuals, these teenagers, is very, very encouraging and seems to set the stage for approval. So we'll see how quickly that comes, and then how quickly we can go ahead and start vaccinating younger age groups.
Right. I mean, 0 is incredible. And then what would you say to, well, first, so we know this came out and it was done in scientifically, the process, all of the methods. But again, I'm just wondering if what I'm hearing just from people around, did this, questions that are coming in, is this too quick? Can this really be true? And what would you say to someone who has that question?
Well, of course, this is all building on an extension of what's been done in adults. And so, we approved the adults with tens of thousands. We've now given the vaccine to over 100 million adults in the United States. And so we really are building off of an incredible evidence base of both safety and efficacy. So the fact that we are able to see this now in a slightly younger age group, 12 to 15, is not surprising, and it's exactly what I think we would have expected to see. Maybe not 100%, that's pretty exceptional, extraordinary, but the fact that it does seem to be as effective in the younger age groups as it was in the older populations is certainly not a major surprise. I think it's important to keep in mind the rationale for vaccinating different populations does vary. So, for example, vaccinating older populations who are at highest risk for death or hospitalization or severe illness is to mostly protect them. Vaccinating younger people is mostly to prevent the spread, because the younger people are the ones who are spreading this like crazy. So it's really that two-pronged approach to addressing the public health challenge that is the COVID pandemic.
Right. That's really interesting, the way that you put that. It's sort of right, to prevent the spread, and then versus preventing getting the vaccination. Because like we said, I mean, children are very they're very rare cases, very rare severe cases, but they spread super spreaders like an asymptomatic, right? I mean, I would say they're asymptomatic
Right.
most of the time. So what would you tell parents who might be hesitant to get their children vaccinated once this comes as maybe emergency authorization approval?
Yeah, no, I mean, I think with children as vectors, it certainly is another important step for families to protect their older generations, because most likely if a grandparent is going to be exposed, it's probably going to be from someone in their family. So that's an important piece of this. And then, of course, we've been debating since the outset, what do we do about school? And so the more we can stabilize the school environments by both protecting the teachers and protecting the students and keeping them from spreading the virus, I think that allows us the best chance to get back to having normal, in-person school and sort of getting our world back as we've been discussing the last couple months.
Right. Well, I think it's a really interesting point that you also just made, Dr. Doring, about we're not starting from scratch here. We've been building on almost a year's worth of evidence that we were able to safely go into this trial, so that the participants or our adolescents, preteens are safe. And in fact, we have tried in adults first. It works, so we feel safe to do the same thing in this next population. And then if I could just ask you another question about AstraZeneca and its study beginning with infants, practically newborn, six months old. I mean, where do we go from there? I mean, the physiology of a newborn versus an adult is it so extreme? So what are your thoughts on that trial?
Yeah, we again, it's not so much the risk to the child, and a big part of what we do in childhood immunizations is to protect the child from things like polio, like Haemophilus influenza type B, and some of the measles, mumps, rubella, all the different things that historically we've prioritized in terms of protecting children from. I think with COVID, if we end up having a vaccine that's eligible for children down to 6 months or 2 years of age or whatever the lower age cutoff will be, it will really be still primarily focused on preventing the spread and achieving that community-wide, that worldwide herd immunity if and when that time comes.
Mhm. And speaking of herd immunity, Dr. Doring, how are we doing in your perspective? How are we doing in terms of Indiana? But of course, Indiana is part of the country. So
Yeah.
your thoughts on the country and your thoughts of cases rising and Indiana perhaps plateauing and actually going up a little bit mildly.
Yeah, we've had incredible success over the last 2 to 3 months with the rates dropping precipitously. 80+% they've dropped over the last 3 months. So we are experiencing a little bit of a plateau at this point, slight uptick in some ways. Some of that's been driven by more highly contagious variants. And so that really just adds urgency to the notion that as many people who can get vaccinated do as soon as possible. So the variants do seem to be susceptible to the vaccine, and the vaccine protects people against the most common variants we're seeing. But it is really a race against time, if you will, in terms of how quickly we can get most of our population vaccinated and or having some natural immunity from having been exposed to COVID, earlier.
Oh, that's so interesting that you say that. I mean, and then, while I have you with us, I'd like to get your thoughts about this dire warning from the CDC. I mean, you had just spoken about plateauing, cases going up. They had said weeks ago that we're expecting this, and now it's happening. Strong words, we're on thin ice. I mean, these are sort of verbatim of which I've heard from the CDC. So why such strong words? And what would you tell people who think, even though we have April 6th we have our lifts of masks, what do we need to know? What do we need to know moving forward, given this warning?
Yeah, I think,
Warning.
yeah, Dr. Walensky was actually a med school classmate of mine. And I think what she's really trying to impress upon all of us across the country is this fight's not over. We still need to do the basic things, as we like to say in other areas, the blocking and the tackling, wearing masks, staying distanced from each other, washing hands is still an important part of this fight until we get a critical mass of people vaccinated and or immune to the virus. And so we're at sort of that juncture where the variants and their higher infectivity is starting to emerge, and we're trying to protect the population with sufficient numbers vaccinated. And so really, in Indiana, I think our approach to protect the oldest populations, the most vulnerable, has been a wise one. So I think we will still be in good shape, even if the spread increases here in the short term. But really, now that everyone can be vaccinated, everyone who's approved to be vaccinated by the FDA can get access to a vaccine in Indiana, it's imperative on all of us to do that as quickly as we possibly can. And that's why we have, several hundred sites up right now to make the vaccine available. That's why we're standing up drive-through vaccine sites all around the state. And so to the extent that we can get vaccinated, let's get it done. Let's lead the way in Indiana. And then by extension, we'll see, I think, the rest of the country also, hit that herd immunity, and we can avert and avoid that doomsday scenario that has the CDC's leadership, concerned right now.
Wow. Well, Dr. Doering, so great to see you. Thank you so much for your insight, as always. I always enjoy speaking with you, and I know this information is very important for our viewers to understand. Thank you.